We appreciate you joining us this afternoon or evening, depending on where you are in the country right now. As you know, the U.S. House Energy and Commerce Committee voted yesterday along party lines to pass a mega bill that would make significant cuts to Medicaid. Today, physicians across the country are calling out these representatives who are also members of the Energy and Commerce Committee for voting for the legislation and sharing how the Medicaid cuts in the mega bill could harm their patients. Before we begin, I'd like to note that the physicians are speaking today as individuals and with us at the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves and not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Lindsay.
Hi, I'm Brian Lindsay. I'm a pulmonology and critical care physician, and I've lived in Iowa's first congressional district since 2011. I'm here with fellow doctors across the country who are speaking out against our federal representatives for voting to raise healthcare costs for and take healthcare away from our patients and fellow constituents. Our members of Congress, as Annika said, are part of the House Energy and Commerce Committee and voted in favor of a mega bill that would take health care away from at least 8.6 million Americans and dramatically raise healthcare costs for many more. And why? All to pay for tax cuts for billionaires. Hardworking Iowa families will pay the price for these billionaire tax cuts, and fellow Iowans should be deeply concerned and outraged. Under the Republican reconciliation bill that my federal representative Marionette Miller Meeks voted for, millions of the people who get their health care through Medicaid could have it taken away. These people are mothers, children, families. They're also seniors and disabled people. Here in Congresswoman Marionette Miller Meeks' district, Iowa's first congressional district, 150,000 people rely on Medicare for their health care. More than half of the people who get Medicaid in Congresswoman Miller Meeks' district are women. More than 70,000 children in Congresswoman Miller Meeks' district rely on Medicaid for their coverage. The reconciliation bill she voted for puts their health care at risk. As physicians, we challenge politicians like Congressman Miller Meeks to explain how taking away her own constituents' health care makes their lives better or our community stronger. Representative Miller Meeks is herself a physician and must be familiar with the tragic stories doctors witness every day when people aren't able to access or afford health care. When people can't see a doctor or afford to get the treatment they need, people suffer. Some go bankrupt because of huge medical bills, and unfortunately, some people die. Doctors see firsthand how access to healthcare can improve and save lives. And we also see the flip side that when people can't see a doctor, they get sicker and suffer needlessly. I was completing my pulmonary specialty training here in Iowa prior to Medicaid expansion in the state, when we would regularly admit asthmatic patients of all ages to the intensive care unit, often requiring invasive life support with ventilators for the primary reason that they were uninsured and could not afford doctor's visits and their life-saving asthma medications. They would have otherwise mild to moderate respiratory infections or other instigators that would become life-altering and sometimes deadly ordeals for these patients. When the Iowa Medicaid expansion was coming online, I had just started my independent practice, and I had patients like a community college student in their early 20s who went from being hospitalized 5 to 6 times per year when uninsured to being able to come in for regular doctor's visits, get important testing, get on a regular and scheduled asthma inhaler recommendation, and get specialty medications for their asthma. Since then, his health has done a 180. He's completed school, he's started a career, and he still comes in to see me, but now it's 1 or 2 times a year in the office for check-ins And he does it with his employer-sponsored insurance that he got from the job he got being able to complete school once his health turned around. Without the Medicaid expansion, this would have been impossible with his health problems and complications he was suffering. Every Iowan must stand up and speak out against this reckless Republican plan to take away people's ability to get medical care so politicians can give huge handouts to billionaires. Representative Miller Meeks may have voted for this in committee, but I believe she can still reverse course and stop these cuts from being finalized. We urge her to do just that. And now I'd like to invite Dr. Lauren Hughes to speak.
Well, good evening, everyone, and thank you, Dr. Lindsay. My name is Dr. Lauren Hughes. I am a family physician, and for the past 4 years have practiced in Fort Lupton, Colorado, which is located in Representative Gabe Evans' district. Nearly every physician here in Colorado and across the nation can share firsthand stories about how access to healthcare protects health and transforms lives. For working Coloradans who don't have health care through their employer or who simply can't afford insurance premiums in the marketplace, Medicaid is how they get health care, and it can be a lifesaver. In the district where I work, Gabe Evans represents just over 214,000 Coloradans who get their health care through Medicaid. This amounts to nearly 1 in 3 people in the 8th Congressional District, including nearly 86,000 women and more than 95,000 children. These include children with a wide range of health conditions who require regular and sustained care, from common ones like asthma to serious conditions such as birth defects or cancer or the impact of trauma. Thanks to Medicaid, they now have a way to see a doctor and to get the treatment and care to manage their conditions. We should make healthcare more accessible to Coloradans and Americans. But Congressman Gabe Evans joined his colleagues on the House Energy and Commerce Committee this week by voting to make it harder for families to get healthcare. They voted to add more paperwork requirements to the Medicaid process and make it easier to kick people off their coverage if they don't get that paperwork in right on time. And it's important to think about everything else that these families are already managing. Parents who are working low-wage jobs and sometimes more than one job, often with irregular schedules, trying to cobble together childcare, pick up kids from school, get dinner on the table, and more, all while prices for groceries and rent continue to go up. Under the bill that Congressman Gabe Evans voted for, now these families will have to do even more paperwork and pay more fees just to keep getting the Medicaid they already qualify for. Making families jump through even more hoops to get the health care they need is likely to lead them to being kicked off of Medicaid. When this happens, more patients like mine will suffer. I'm thinking of one of my patients, a man in his 60s with severe COPD, who finally stopped smoking and got on the right inhalers to manage his condition. This combination of factors allowed him to return to work part-time. When he lost Medicaid last year due to administrative reasons, he started spacing out the use of his expensive medications he wouldn't have otherwise been able to afford, and ended up with a severe exacerbation of his underlying condition that required a trip to the emergency department and ultimately hospitalization. This is one of many examples I have witnessed of what happens to my patients when Medicaid coverage is disrupted. It doesn't have to be this way. Congressman Gabe Evans doesn't have to keep supporting Medicaid cuts. I'm deeply disappointed that he has voted to take health care away from my patients and urge him to reconsider future support. I'd now like to invite Dr. Sloan to share his thoughts.
Thank you, Dr. Hughes. I'm Victor Sloan. I'm a rheumatologist in New Jersey. I spent most of my career in the pharmaceutical industry while seeing patients for 24 years as a volunteer as part of the clinical faculty at Rutgers Robert Wood Johnson Medical School. My colleagues on this call have already shared with you some of the harmful impacts of these cuts to Medicaid, including burdensome red tape that's really designed to keep people from getting health care. We shouldn't be fooled. This paperwork is just another way that some people in Congress want to use to ensure that people who do qualify can have their health care taken away. I live in Congressman Tom Kaine's Jr.'s district, New Jersey 7. In this district, Medicaid provides care to more than 70,000 people. 27,000 of those are children. 15% of all the children in the district get their health care from Medicaid. I've reached out to Congressman Kane about the cuts, and his response was that these programs are, quote, riddled with waste, fraud, and abuse, unquote. But we need to understand that these cuts will disproportionately harm women and children. There are already multiple mechanisms in place to deal with fraud, including the Medicaid fraud control units. And most mistakes are paperwork errors, not overt fraud. These proposed barriers will harm women with disabilities or illnesses who don't qualify for an exemption or struggle with the bureaucratic hurdles to get an exemption. I have a friend who's an attorney and a retired judge here in New Jersey. He's given me permission to share his story. He and his wife have a 50-year-old son who is autistic and receives Medicaid. Their son's been in a community apartment and has been making great progress for 15 years. But my friend tells me that if these cuts go through, their son would likely be institutionalized or, quote, at age 80, we'll have to figure out how to care for him, unquote. That's not dealing with fraud, waste, and abuse. Under the plan that Representative Kane voted for, women and families who rely on Medicaid will have to pay more and complete more paperwork to use the coverage they're entitled to. For working people and families, it's already hard enough to get by. It's hard enough to jump through all the hoops to get Medicaid just one time a year. Now they'll have to do it twice. They'll have to drive farther to their local offices to verify their income and person. These barriers will mean millions of Americans will just have their health care taken away. I had a patient with severe lupus. She was disabled from the complications of this devastating disease, and she still managed to take care of her young son. She relied on Medicaid for her health care. She couldn't work because she was disabled. The plan for the Representative Kane and the House Energy and Commerce Committee voted for imposes red tape work requirements, even though, according to the Kaiser Family Foundation, almost two-thirds of people who get Medicaid health care and are not on disability already work. Work requirements disproportionately harm working women. Many women enrolled in Medicaid work in low-paying jobs where inconsistent schedules can prevent them from getting the required number of hours every month, and where an illness or a family emergency could lead to loss of job and loss of Medicaid. Many of my own patients who received Medicaid worked, but often in jobs that didn't provide insurance, or they couldn't work full-time because they were caring for children or aging parents. I've seen what happens when women can't get health care. They can't care for themselves, they can't care for their families or their aging parents. I urge Congressman Kane and our leaders in Congress to do the right thing and vote no when this bill comes to a full vote. Stop supporting taking away health care from our patients to pay for tax cuts for the wealthy. And I'd now like to turn it over to Dr. Crater. Thank you.
Thanks so much, Dr. Sloan. I am Dr. Christine Crater. I am a palliative medicine physician in St. Clair Shores, Michigan, the district of Congressman John James. Like my colleagues on this call, my representative, Congressman John James, is a member of the Energy and Commerce Committee who voted this week in favor of cutting Medicaid. And what we urge Congressman James to remember as he puts people's health care on the chopping block is that 182,000 people in his district get their health care through Medicaid. That's more than 1 in 4 people in Oakland and Macomb counties, with more than half of them women. 67,000 children in Michigan's 10th congressional district rely on Medicaid, and 17,000 seniors. As a palliative medicine physician, I especially worry how senior Michiganders will fare under the legislation Congressman James voted for this week. This megabill won't just take healthcare away from many people. It will also raise healthcare costs for many people, including seniors. Many poor, older, and disabled people are enrolled in Medicare, but rely on Medicaid to cover copayments that they can't afford. So if their Medicaid is taken away, as it could be under the legislation that Congressman James voted for, these seniors and disabled people might not be able to pay their copayments or other costs. The Republican plan would make it harder for some seniors to get care in nursing homes. I care for people like these in my practice. With Medicaid, as it is currently funded, these patients can receive end-of-life care in a nursing facility with the support of hospice, allowing their loved ones to spend quality time with them as family or friends, not being their caregivers. Without the support of Medicaid, these patients would be responsible for the daily room and board charge at a nursing facility, which averages about $300 per day. That cost is prohibitive for most patients, but especially for those who are living barely at or above the poverty level. When I'm able to share with a patient and their family that they will be able to receive quality end-of-life care that's covered by Medicaid, they are so relieved to be able to focus on the work of memory making and the important life completion activities rather than creating a schedule of caregivers, care responsibilities, and worrying about how that will be paid for. Many of these patients simply couldn't afford this care without Medicaid. Their families couldn't afford this care without Medicaid. Taking away Medicaid from these patients would mean taking away care and dignity for senior citizens and patients nearing the end of their life in my community. Michigan's seniors deserve better. Michigan's families deserve better. They deserve better than this Republican plan supported by Congressman John James. We call on Congressman James and all of our representatives to stop supporting these Medicaid cuts. Thank you very much.
Thank you so much, Dr. Crater, Dr. Sloan, Dr. Hughes, and Dr. Lindsay. We have time for questions now. If you would like to ask a question of one or any of the physicians, there are a few ways you can do so. You're welcome to use the chat function or the Q&A function to type your question. Or if you prefer, you can raise your hand and I can allow you to unmute and verbally ask your question. So we'll allow a few moments for folks to be able to do that. I see one question. I'm sorry, one hand raised rather. You should be able to talk now.
Can you hear me?
Yes, yep.
Okay. So my question is actually for the physician from Iowa. My name's Faven Zodu. I represent Iowa's News Now. So I understand that this bill has a lot of information that's kind of just jam-packed into one document. So I would like the physician to break down how these changes would directly affect somebody that is watching this.
So that's a big ask. It is a big bill, like you said. I got a chance to read. It just kind of got finalized in the last 48 hours, and I got to look at some of it. So this is by no means, like an exhaustive answer. But one of the big things we talked about is that if you're on Medicaid now, they're going to make the red tape you have to go through to register that you're working or that you're in school, both kind of more onerous and hard to complete. And they're going to make you do it twice a year, and in some cases more frequently than that, to keep your coverage. And what's important to note is, like I think Dr. Sloan mentioned, the studies are clear that putting in these work requirements don't, lead to more people working. What they lead to is more people losing coverage, which is kind of actually the real point of putting them in. The House Energy, and Commerce Committee, was tasked with finding $800 billion in cuts. And one of the ways, and they know from other states and previous states, is that one of the ways to get cuts is to put in work requirements with lots of red tape that people can't fill out, and then you can kick them off their coverage. It's not about getting people new jobs. It's about kicking people who would otherwise be on it off their coverage. So that's one of the big points. And, as I mentioned in my story, if you want people to work, have them be healthy. Give them coverage, get them healthy, and then they will go to work. So that's probably like the biggest thing that I saw when reading it. I don't know if somebody else wants to chime in with some of the other, big parts of the bill, but um, that's the biggest one that I saw.
Absolutely. Thanks, Dr. Lindsay, and thanks for the question, Faven. I see John has his hand raised. You should be able to ask your question now, John.
Yes, thank you. This is John King with Michigan Advance. My question is for Dr. Crater. I'm curious, are your patients aware of the extent that these cuts are going to affect them? Have they expressed their fears about how this is going to affect them and their health care? And is there any, with some of your patients, maybe a bit of a cognitive dissonance where they are really dependent on Medicaid, but they, see this as like, this is waste, fraud, and abuse, and this is all good?
I, thanks for that question. I would say that at the point that many of my patients are at, I'm dealing with patients who are managing serious illness and oftentimes nearing the end of their life, and they are not people who are generally able to think about anybody but what is consuming them at the moment. I have had patients in my outpatient clinic who, as Dr. Lindsay was describing, people would lose coverage because of red tape. We had challenges in Michigan when people had to reconfirm and go through all of the paperwork to qualify again for Medicaid. And I had at least two patients in my clinic who, for a period of time, were without insurance and were worried that they were not going to be able to see me as a physician, that they were not going to be able to pay for pain medications that they were taking for stage 4 cancer. And so I don't feel that my patient population really understands the impact of these Medicaid cuts. I'm not sure they believe it will actually happen because all of them wonder, how could humans do this to other humans?
Annika, if I might just add a little bit more, I think it was
Yeah,
an excellent question, John. And I'd say with my patient population in Colorado, and similar to what Dr. Crater just mentioned, we just got done with a pretty rocky eligibility redetermination process after the public health emergency ended. And so a lot of my patients have had to weather those challenges. And so their awareness of what can happen when Medicaid is disrupted is quite high for the patients that I care for. A lot of organizations in my state have been putting out, as organizations nationwide have been doing, putting out estimates of the impact, both from a financial standpoint and from a health and access, health outcome standpoint, if different federal proposals would come true and ultimately pass. And so some of my patients have been asking about some of those. It's been hard to respond because we didn't know what was going to come through in the debates this week. And so I'd say heightened awareness, and I'm certain starting next week and beyond, I'll have even more conversations with patients about what this might mean for them specifically. So I predict that will be a big part of my patient visits over the next few weeks.
And just to add one more thing to that, my friend emailed me today with a copy of his email to Congressman Kane after the vote saying, "You have failed me and my son." So they are painfully aware of what this could mean. And I echo Dr. Crater's comment, how could humans do this to other humans?
thanks for the question, John. I had a question chatted to me. I'm putting in the chat for everyone. Analysis of the Megabill shows that it could increase uncompensated care in hospitals. Can you talk about how this could impact rural hospitals with already thin margins and people who live near them? And I believe that's for anyone who would like to answer.
I think it's painfully obvious. If someone comes to the emergency room, they have to be seen. And those costs get passed on to everyone. And as Dr. Lindsay said, when people get health care, they can work, they can take care of their families. When they don't have good health care, they're sick more often. They go to the doctor more often. They go to the hospital more often. So it ends up costing more in the long run. So in addition to being cruel, this is penny wise and pound foolish.
That was an excellent response, Dr. Sloan. I'm happy to add more to this. In addition to my clinical work, I do work in health policy, and I focus on improving rural healthcare delivery, primary care, and behavioral health integration. And so this has been a common question or concern, what a variety of potential Medicaid cuts, including an increase in uncompensated care, would mean for the viability of rural hospitals that are often incredibly valuable institutions in their communities. I'll respond to this question in two ways. I'll talk first about the institution of the hospital and the community, and then what this means for those patients in those communities. With a concern for uncompensated care increasing, if you couple that with a decline in Medicaid revenue coming into these facilities for a wide variety of reasons, this absolutely would very likely lead to further destabilization for hospitals, many of which already are operating at slim positive margins, if best, and many are operating in the red across the country. This may put these hospitals in a position of having to decide, do we close this service line? Like say, do we close labor and delivery, right? Which cuts off access to those important services in that community. And or in severe cases, do we have to close permanently altogether, right? And often a rural hospital has, it's the largest, if not the second or third largest employer in a rural community and offers high paying jobs. If the service line closes or that hospital closes, you lose those high paying jobs. And those individuals will start to commute away from that community to work and may leave. And that impacts ultimately your tax base to support other needed services in that community, making it hard in the future to attract and retain new businesses when you don't have local access to healthcare. So that's what can happen to the hospitals and to the communities. And then very much what Dr. Sloan said about the individual patients in these communities, with any kind of Medicaid cuts, it will lead to increased uninsured rates. And then patients would have to decide, am I going to skip care? Am I going to delay care? How am I going to navigate that? And for all of us, that could lead to rising costs because acute exacerbations of chronic illnesses are more expensive. And ultimately, if that rural hospital closes a service line or closes altogether, those patients may have to seek care in urban centers where the cost of that care could very well be more expensive than it would be if it had been offered locally. So it's an excellent question, and it's really a domino effect that we might see both to the patients, the hospital, and to the local economies in these rural and frontier communities.
Yeah, I actually just came from one of these hospitals. I was there. I do an outreach clinic at a couple different hospitals that operate like this a few times a month. And, you know, they've come a long way in the last 10 years since the Affordable Care Act was passed and some of this uncompensated care, got reduced where they've, you know, some of the ones that I'm familiar with, have stabilized and are able to operate, a little more comfortably, but a little more comfortably is the operative word. There's still, none of them are comfortable. And, like Lauren said, they're relatively high paying jobs compared to some of the other jobs in the community. But, most of the staff working at these hospitals are, nobody's getting rich. They're not, well paid compared to what people would consider like in the cities, and certainly what the people who are asking these politicians for the tax cuts are getting paid. I mean, these people are often hourly paid, and you'd look at it and be like, that's not that much considering how important the job they do. And these hospitals, don't pay them a lot just to keep a positive margin as it is right now. So there's no meat left on the bone for these people to cut. And so if we, increase this uncompensated care even a little bit, they're going to have to lay people off. They're going to have to close stuff because it's not like, any fat that they can trim, they've already learned how to trim. So there's not anything left if we up the uncompensated care again.
I agree with what both Dr. Lindsay and Dr. Hughes have said, and I practice in urban settings, and many of my patients are very poor people. One of the hospitals that I practice at has 30% of their patients are Medicaid patients. And you can imagine that if even a fraction of those Medicaid patients lose their Medicaid and then are um, um, coming to the hospital and needing to receive uncompensated care, that even urban hospitals will struggle to make any margin. And one of the hospitals that I work at already has closed their labor and delivery unit. So these things are not just impacting rural settings. Obviously, it's more devastating because there are so few resources, but I worry that even in urban settings, we will lose particularly inner city urban hospitals with Medicaid cuts.
Thank you all for that input and thanks for that question. I'm not seeing any additional questions, so we'll go ahead and conclude this evening's call. I want to thank all of the reporters and members of the media who were able to join. I know it's a busy time, so we appreciate your time today. And thank you so much to our speakers and advocates, Dr. Lindsay, Dr. Hughes, Dr. Sloan, and Dr. Crater. We appreciate your time and your speaking out on behalf of your patients and all the people in your states. Thanks so much, everyone. Hope you have a good rest of
Thanks.
the evening.